Hello.
Hello, my name is Julie Gottfried. I'm the Pediatric Service Educator for the Department of Nursing over at Gottfried Children's Hospital in Rochester, New York. And I'm also a student with the Doctor of Nursing Practice program at the University of Rochester.
Oh, thank you. I'm Chuck Schumer, as you know, a U.S. Senator. Thank you for coming to my office. Why don't you have a seat?
Thank you.
I'm so glad that you were able to take the opportunity to meet with me today, and I really appreciate your taking the time to do this.
Of course.
I'm here because I am passionate about the topic of sepsis and what we can best do to help raise awareness within the public and also within the healthcare community itself. So as you may be familiar, there is proposed legislation right now that is called the Rory Staunton CARE Act, and what the CARE stands for is Coordination, Awareness, Research, and Education. And the reason why I wanted to meet with you today specifically was to ask for your assistance in helping to support Congressman Joe Crowley from the Bronx, who you may be familiar with, because he's the one who is pushing forth this legislation. And I wanted to explore a little bit more about what the education component of this education should be comprised of. Does that sound okay to you?
Oh, this sounds wonderful. It's funny you say the University of Rochester, because I have worked quite closely with other students.
No way!
So I'm very happy to hear about your initiative and what you have to say about things. I'm also on the healthcare subcommittee of the finance committee, and I'm also very close with the Senator Crowley, and I do have a relationship with the Rory family themselves. So I'm very anxious to hear about what you have to say. I'm very interested in your information.
Well, again, I just wanted to say this means so much that you were willing to take the time to meet with me today. I was actually there at the first National Sepsis Forum that was held back on September 17th.
Yes, just last
and you were
week, yes.
and you were one of the keynote speakers. So I knew that you had a vested interest in this topic, and so that's why I wanted to reach out to you to tell you a little bit more about my knowledge with this topic, and to hopefully be able to provide you with more of the resources that you need in order to help support this legislation for moving forward.
Yes.
So, in my role as a service educator for Gottfried Children's Hospital at the University of Rochester, I've had the opportunity to help our organization enact the fairly recent legislation from 2013. So just to give a little bit of background, I know that you said that you were personal friends with Rory Staunton and his parents.
Yes.
So as you know, Rory Staunton is unfortunately now deceased. He was a 12-year-old boy who back in April of 2012 ended up contracting sepsis from a cut on his arm that he obtained during basketball practice. I know it's tragic.
Very tragic.
And due to a series of miscommunication between healthcare providers, he ended up healthy, a 12-year-old on a Wednesday, and dead by Sunday. So as a result of that, our former health commissioner, Dr. NUR Shaw, helped push forward some proposed legislation at that time, which was called Rory's Regulations, which did get passed and went into effect as of December 31st, 2013. So what the New York State legislation had comprised of was, it was the first state in the country that mandated that hospitals implement identification and treatment protocols for sepsis. But a component of that legislation also involved a mandate that there be education for healthcare professionals, and they defined healthcare professionals as representatives from the fields of medicine, nursing, and pharmacy. So each hospital had to submit to the state their plan for educating staff with regards to these new protocols, and again, focusing on early recognition and management, because the earlier that you can recognize somebody in sepsis, the more likely you are to be able to avoid that end of the continuum where by the time you get into septic shock, your chances for survival are greatly diminished as opposed to catching it earlier. So based off from that previous experience, I've really had a lot of very positive interactions with members of my healthcare team in the hospital that I work at with regards to implementing education, and I wanted to be able to use New York State's legislation as a template for the Rory Staunton CARE Act, which again, as you know, will be is proposed legislation at the federal level. So New York State, and I'm proud to say, being a true trailblazer for paving the way for the rest of the country for this being the way that we should be able to handle and manage sepsis. So just a little bit about sepsis. It is.
I was going to ask you what that is.
Yeah.
So what is there a definition for it? Or?
That's a great question. So sepsis is what is called SIRS. So SIRS stands for suspected, inflammatory response syndrome in the presence of a suspected infection.
Okay.
So sepsis is really along a continuum, with SIRS being at the less virulent end, progressing to sepsis, severe sepsis, then ultimately septic shock. So sepsis is found in a variety of healthcare conditions. So when you have folks that die of pneumonia, people who die from hospital-acquired infections, really what they ultimately end up dying from is multi-organ system dysfunction related to sepsis in its most severe form. So this is a common healthcare enemy that has been seen time and time again in patients who are hospitalized. And what is really key here is that sepsis can be difficult to identify in its early stages. And so there's really an impetus for us to be able to educate our healthcare professionals so that they're able to recognize it early. Recent literature has shown that for every hour that sepsis goes by undetected, there's a 10% increase in mortality. So
it's really incredible.
Yeah, it becomes just essential for being able to capture it early, and then once identified, be able to provide aggressive treatment. So looking at using the New York State legislation as a potential template for this federal education, kind of putting it more into a global, both a national and international context. Currently, the Centers for Medicare and Medicaid Services have been having back and forth discussions about whether they're going to include this in one of their process measures, this being sepsis, of course, is one of their process measures for reimbursement. So, for example, we have things such as CLABSI, which is our central line bloodstream infection rates, and CAUTI, so our catheter-associated urinary tract infection rates, which hospitals are tracking to see if we are meeting standards, national standards, for being able to reduce those infections amongst our hospitalized patients. And so CMS is, right now has been, again, discussing whether they're going to move this forward as one of their reimbursement measures. And so I believe that if I tried to do my research in preparation for our meeting today, and so I believe that you had helped Senator Crowley with his Rory Staunton Proposed Care Act,
Yes.
with, I think it was composing a letter to the administrator of CMS.
Yes, there was a letter that was sent around, and how very important it is that they continue their work for the reimbursement. And there were many people that did sign the letter. In fact, I have a copy of it right here with me.
Okay.
So of course it was Senator Crowley himself that did sign this. There was Louise Slaughter. You probably know her.
Certainly do. Yes.
Heard of her. There's
Looks like
Senator Nadler and Mahoney. So there were quite a few people that do feel the same way, I believe, that you do, and that this is very important. And so this was a very, very important piece of information that was sent around. So there is a lot of backing in the legislature for that.
I'm so glad to hear that. When, as you know, at that recent National Sepsis Forum back in September, Dr. Patrick Conway, who's the Deputy Administrator for Innovation and Quality and the Chief Medical Officer for CMS, he had announced that CMS is in the process of incorporating sepsis detection and reduction goals into their pay-for-performance programs, with 2015 hopefully being the first year.
It'll be here before you know it.
Yes, it will. So
very important.
So I think that this is really within the national political field. I think that this is a very important topic. So I wanted to talk a little bit more specifically again about the actual educational component. So to give a little bit more of the background, the Josiah Macy Foundation had a 2007 conference that was comprised of top experts within the fields of medicine and nursing to make recommendations for continuing education. So continuing education is educational efforts that are directed towards currently practicing licensed healthcare professions. So what this expert panel had recommended was designing well-crafted education that unites education and work as mutually dependent, forming a seamless process of employing clinical performance data, such as sepsis, to determine gaps in practice, establishing learning and other strategies to address these needs, and evaluating the outcome. So in preparation for our meeting, I had delved into the literature to see what other healthcare organizations have been doing with regards to their sepsis education. So there was some folks, Armin and colleagues, that had used a needs assessment to drive educational design. So essentially putting out a survey to current staff to see where the knowledge gaps were with sepsis recognition and management, and then driving both an online didactic component as well as supplemental materials such as brochures, pocket cards, etc., based off from the gaps that were identified through this learning needs assessment. And really the results were quite remarkable. The intervention group in their study had a 30% lower odds of dying ratio and incurred on average about $2,000 less in hospital costs. So very strong evidence in support of using a needs assessment. Second option would be to use simulation to enhance team-based sepsis care. So there's a buzzword going around now called interprofessional. And so what this word interprofessional in the context of education means is that members from 2 or more healthcare professions learning about, with, and from each other. So with this simulation to enhance team-based sepsis care, Owen and his colleagues had utilized interprofessional workplace scenarios to improve sepsis outcomes. But unfortunately, they had a small sample size, so they weren't really able to drive statistically significant differences in their healthcare professionals' learning, both pre and post intervention. There was a third option that was proposed by Friedman, Dorfler, and Tammuz in their Taming Sepsis Education Program, otherwise known as TSEP, which is based out of the North Shore Long Island Jewish healthcare system. Through this program, the North Shore healthcare system had seen a greater than 50% reduction in sepsis mortality rates from 31% in 2009 to 15% in October 2013. The problem with their study is that they weren't able to really attribute that drop in sepsis rates to just their educational intervention alone. So really based off from taking an in-depth look at the evidence to see what could potentially be the best way to educate healthcare professionals, I would have to advise using a needs assessment. So again, a needs assessment really being a survey of different targeted focus areas with relation to sepsis identification to be able to determine, and management, to be able to determine where the gaps currently exist with the health workforce, and then being able to design educational strategies and interventions to target those areas of need.
Well, this sounds great. It sounds like you really did a lot of hard work, and that's great information
Thank you.
to help a very need area in that healthcare. It seems like people would have learned this through their education.
So that's a great point, and I'm sorry, I didn't mean to.
Yeah, no, that's fine.
I'm so sorry, Mr. Schumer, I didn't want to interrupt you while you were talking.
That's totally fine.
But one of the challenges that we have discovered, working in healthcare, is that people learn a lot of things when they're in medical school, nursing school, pharmacy school, etc. And there's no way that you can remember all of that when you're in the clinical arena. And so there's really a push, both nationally and internationally, on making focused efforts towards patient safety. And so how do we reinforce the learning that's done in the pre-licensure setting when it's being applied to patients in the clinical setting by post-licensure healthcare professionals? So I agree. People have, at least in theory, learned about this while they were still in school, but it's kind of a different flair when they're out in practice.
Yes, no, I can understand that. And I think what is so wonderful in having experience working with some other U of R students in the past, like yourself, is that you bring so much to the table. And this is how we, as the government, senators, assemblymen and women, really learn and get our information from you. So I'm very excited that the U of R and many other schools do bring this to the table and enlighten our education about important things like this. So I definitely will be with Senator Crowley and moving this forward. I think it's a very important initiative.
I'm so glad to hear that. Well, thank you so much, Senator Schumer. I really appreciate the fact that you were willing to meet with me today.
Thank you so much for coming.
Don't hesitate to reach out to me if you have any questions in the future regarding this important topic.
Thank you so much.